Greetings, everyone. My name is David Dyjack, Executive Director of the National Environmental Health Association. And today I'm joined by Jesse Bliss, the Director of Programs and Partnerships at our association. Jesse is an infectious disease expert, and we've asked him to speak with us for a few moments today about the coronavirus, the novel coronavirus, which has broken out in Wuhan, China. Welcome, Jesse. Glad you're part of the team now. I hope you're enjoying your time here in Denver.
Yes, thank you so much. It's a pleasure to be here and being able to transition back and forth from Washington, D.C., where I'm centered right in the mix of everything and keeping abreast of what's happening within the field. And so it's a great opportunity to be here and visit with you.
Well, the timing of your hire is perfect. Given your background and interest in infectious disease, what can you tell us about this novel coronavirus? What is it? How is it transmitted, and anything else you'd like to share about the symptoms or anything else our members should know about what's emerging right now in China and the United States?
Yeah, sure. To begin with, coronaviruses are a group of viruses that are commonly found in animals. And so what makes this a unique situation here is that a novel virus is something that is recently introduced to the human population. So this is the first time this particular virus is being seen within human population. And so that transmission from animals to humans is also known as a zoonotic infection. And so as a coronavirus, because we haven't seen this virus before, we don't know, our body doesn't know how to respond to it. There are not vaccines for that at the moment. And so because there aren't vaccines, then our exposure and our risk to contracting illness is really going to be dependent on whether or not you have a contact or exposure to that. It transmits similar to the common cold. So coughing, sneezing, contacting contaminated surfaces, touching your hands to your face, mouth, ears, nose, places where you can actually have entry points into your body. And then depending on the illness right now, it's your symptoms that you can have from this are, cough, runny nose, fever. But for certain populations, it can be more it can carry higher risk for complications.
And who are those people that are at higher risk?
So generally, we're talking about those who are on kind of either end of the age spectrum. So those who are young, so young children, as well as those who are over the age of 65.
I'm rapidly approaching that age of 65, so I need to be careful myself. So there is no vaccine, is that correct?
That's correct. As a novel virus, we don't have vaccines to prevent that. Treatment for this is the same thing you would do for a common cold. I mean, you're trying to make sure and keep hydrated. So if it becomes a severe complication with this, you end up hospitalized. They'll be giving you IV fluids to try to keep you hydrated. But it's a respiratory infection. And so something that gets into the respiratory tract, as we know with SARS, depending on the complications for what that arises, your body's response can vary.
Okay, well, thanks for that information. As you know, the second largest part of the public health workforce, the second largest component, are environmental health professionals behind nursing. What recommendations, if any, do you have for our constituency, professionals, who are largely profoundly local in local communities? Do you have any recommendations for them and what their role might be with this outbreak?
Sure. I mean, depending on their role, whether they're food inspectors or what their role within their community is, they may come into a point where they're going to be asked. They are looked to as a source of information about infections and about things that could be related to different exposures. And so, just making sure that they're aware of what the virus is, that they have an answer to describe what it is, what the risks are, and how to prevent getting sick. And in addition to that, if their local emergency operations center were to stand up, if they were invited to participate, take that as an opportunity to go and share from the environmental health perspective what the importance is of personal preparedness, making sure that your personal hand hygiene, hand washing frequently, cough and sneeze etiquette, that you're coughing and sneezing in your elbow or into a tissue and throwing that away, trying to prevent from getting others sick. So, you can prevent both directions of that transmission and receiving it.
Fantastic. Well, I'm glad you're here in Denver sharing your expertise with our staff and our constituency at large. We would ask our members to go to our website at www.neha.org for updates on the coronavirus and this public health emergency. We know that the Emergency Operations Center at the U.S. Centers for Disease Control has been opened, so we ask everyone to pay attention to this issue. It's very serious, and return to our website frequently for updates on information that may be useful to you in your local community. Signing off from Denver, Colorado, I'm David Dyjack, Executive Director of the National Environmental Health Association.